Hello, I'm Dr. Amir. Welcome to today's health session. Today we will discuss the condition called cough. Before we start our session, it is requested to kindly subscribe to the channel and share with your loved one and the community for health awareness.
Dr. Amir, what is the cough?
A cough is a sudden, forceful exhalation of air from the lungs that helps clear the airways of irritants, mucus, or foreign particles. It is a reflex action triggered by irritation in the throat or respiratory tract. Coughing can be caused by infections, allergies, smoking, or underlying medical conditions.
Dr. Amir, what is cough made of?
Cough is a forceful expulsion of air from the lungs. It involves rapid contraction of the diaphragm and chest muscles, leading to a sudden release of air through the vocal cords. Coughing helps clear the airways by expelling irritants, mucus, or foreign particles, aiding in maintaining respiratory health.
Dr. Amir, what causes the cough?
Coughing is a reflex action that clears irritants, mucus, or foreign substances from the airways. It's a protective mechanism triggered by infections, allergies, smoke, or underlying conditions. Coughing helps maintain respiratory health by expelling potential threats and maintaining the integrity of the respiratory system.
Dr. Amir, what is the difference between dry cough and productive cough?
A dry cough is non-productive, lacking mucus or phlegm, often caused by irritants or viral infections. A productive cough produces mucus or phlegm, aiding in clearing airways of irritants, infection, or lung conditions. The distinction helps diagnose and treat underlying causes, and recovery.
Dr. Amir, what is the difference between acute cough and chronic cough?
An acute cough lasts for a short period, usually less than 3 weeks, commonly caused by infections or irritants. A chronic cough persists for more than 8 weeks, indicating underlying issues like asthma or lung disease. Distinguishing helps determine appropriate treatment and long-term health concerns.
Dr. Amir, why asthma causes cough?
Asthma can cause coughing due to airway inflammation and sensitivity. The inflamed airways produce excess mucus, leading to coughing as the body tries to clear the mucus. Additionally, the narrowing of air passages during an asthma attack can trigger coughing as the body attempts to restore normal airflow.
Dr. Amir, what is whooping cough?
Whooping cough, or pertussis, is a highly contagious bacterial infection that primarily affects the respiratory system. It causes severe, persistent coughing fits often followed by a distinctive whooping sound as the person inhales. Vaccination is crucial, particularly in infants and young children.
Dr. Amir, whose vaccine is for whooping cough?
The vaccine for whooping cough, also known as pertussis, is typically administered as part of a DTaP, diphtheria, tetanus, and acellular pertussis vaccine for infants and young children. Adolescents and adults may receive the Tdap, tetanus, diphtheria, and acellular pertussis vaccine to provide immunity against whooping cough and other diseases.
Dr. Amir, how do you diagnose a cough?
Diagnosing a cough involves a medical history review, physical examination, and potential tests such as chest x-rays, lung function tests, or blood work. The underlying cause is identified through evaluating symptoms, duration, and associated factors like allergies, infections, or chronic conditions, enabling targeted treatment and management.
Dr. Amir, how long can a cough last?
The duration of a cough can vary depending on its cause. Acute coughs often last for a few days to a few weeks, while chronic coughs can persist for more than 8 weeks. It's important to consult a medical professional if a cough persists or worsens.
Dr. Amir, what are the signs and symptoms of a cough?
Cough symptoms include a repetitive expulsion of air from the lungs, often accompanied by a distinctive sound. It may be dry or produce mucus, and can indicate underlying conditions like infections, allergies, asthma, or more. Persistent cough, chest discomfort, and difficulty breathing may require medical evaluation.
Dr. Amir, who is most vulnerable to cough?
People with weakened immune systems, young children, the elderly, and individuals with respiratory conditions like asthma or chronic obstructive pulmonary disease are particularly vulnerable to coughs. Environmental factors, such as exposure to allergens or pollutants, can also increase susceptibility to coughing.
Dr. Amir, why cough worse at night?
Coughing can worsen at night due to several factors. Postnasal drip, lying down causing mucus to pool, increased irritation in the airways when breathing dry air, and suppressed cough reflex leading to accumulation of irritants. Treating underlying causes and using proper sleep positioning can help alleviate nighttime coughing.
Dr. Amir, what is instant cough relief?
For instant cough relief, try drinking warm fluids like honey and lemon tea, using cough drops or lozenges, inhaling steam, using a humidifier, and avoiding irritants. Over-the-counter cough suppressants or expectorants can also provide temporary relief, but consult a healthcare professional before using any medication, especially for prolonged coughs.
Dr. Amir, how to treat the cough in children?
To treat cough in children, ensure proper hydration, provide a humidifier, elevate their head during sleep, and maintain a clean indoor environment. For children over 1 year old, honey can soothe coughs. Consult a pediatrician before using any over-the-counter medications and seek medical attention if coughing is severe or persistent.
Dr. Amir, what is the role of the nebulizer in a cough?
A nebulizer is a medical device that converts liquid medication into a fine mist for inhalation. It can help manage cough by delivering bronchodilators or other respiratory medications directly to the airways, reducing inflammation and improving airflow. Nebulizers are often used to treat respiratory conditions like asthma and chronic obstructive pulmonary disease, COPD.
Dr. Amir, what is the treatment for a cough?
Cough treatment depends on the underlying cause. It may include addressing infections with antibiotics, managing allergies with antihistamines, using bronchodilators for asthma, or addressing gastroesophageal reflux disease. For symptomatic relief, rest, hydration, honey, humidifiers, and over-the-counter cough medications can help, but consult a healthcare professional for guidance.
Thank you, Dr. Amir. Your insights have empowered us to make better choices for our well-being. Your dedication to spreading knowledge is greatly appreciated.
Goodbye. Remember, maintaining good health and seeking medical advice when needed are important steps towards a healthy life. Subscribe to the channel and share for health awareness. Take care.